Welcome to this video on metabolic disorders and their nutritional interventions. Metabolism is the sum of physical, chemical, and metabolic processes relating to the absorption, breakdown, or synthesis of necessary organic molecules in the body. A disturbance in one or more of these processes is known as a metabolic disorder. The transition period for animals refers to the stage of moving from the dry, non-lactating phase to the lactating phase. This typically covers the last 3 weeks of gestation and the first 3 weeks of lactation. Metabolic disorders are disturbances of metabolic processes in animals. In dairy animals, the critical time is 3 weeks before and after parturition. Influencing factors include hormonal changes, the transition from non-lactating to lactating stages, and changes in diet. Common metabolic disorders include milk fever, ketosis, Downer cow syndrome, acidosis, SARA, hypomagnesic tetany, and PPH. Milk fever, or parturient paresis, is an acute to peracute paralysis of mature dairy cows that occurs around parturition. It is caused by hypocalcemia. A normal calcium level is 8 to 12 milligrams per deciliter. Milk fever occurs when it drops below 7.5 milligrams per deciliter. Milk fever generally occurs after 72 hours of parturition. Dairy cows secrete calcium for colostrum and milk production, causing serum calcium to decline. This decrease can lead to hyperexcitability, tetany, and paresis. It is more common in Jersey cows and in cows during their 4th to 6th lactation. Clinical findings usually occur 72 hours after parturition and may contribute to complications like dystocia and mastitis. Milk fever has 3 stages. In the first stage, animals are ambulatory but show hypersensitivity. In the second stage, animals are unable to stand but can maintain sternal recumbency, and blood calcium levels are about 4.5 to 6 milligrams per deciliter. In stage 3, cows progressively lose consciousness, leading to coma. Cardiac output worsens, and peripheral pulses may be undetectable. Symptoms include bloat, flaccid muscles, and a risk of death. Blood calcium levels will be below 4.5 milligrams per deciliter. Treatment involves an intravenous dose of calcium borogluconate followed by a subcutaneous dose. Prevention includes feeding a diet with less than 20 grams of calcium per day during the 2 weeks before calving and avoiding excess calcium during the dry period. Feeding acidifying rations with a negative DCAD before calving can reduce the risk of milk fever by improving calcium availability. Also, vitamin D supplementation of 21,000 IU per day during the transition period is important for overall health and productivity. Ketosis, or acetonemia, is a metabolic disorder where energy demands exceed intake, leading to a negative energy balance and low blood glucose. In ruminants, it is characterized by impaired carbohydrate and volatile fatty acid metabolism, resulting in ketonemia, ketonuria, ketolactia, and hypoglycemia. Ketosis occurs when body fat is utilized faster than the liver can metabolize it, causing ketone production to exceed utilization. In beef cows, this is common in late pregnancy. In dairy cows, it often occurs in early lactation due to insufficient energy intake to match milk production loss. Insufficient feed intake leads to insufficient ruminal propionic acid, a glucose precursor. This causes low blood sugar, which triggers the metabolism of fatty acids and glycerol. The resulting excess of acetyl-CoA, due to lack of energy, is converted to ketone bodies, resulting in ketosis. Symptoms of ketosis include reduced milk yield, weight loss, and reduced appetite. Other signs are a dull coat, an acetone or pear drop smell of breath or milk, fever, and nervous signs, such as excess salivation and licking. Treatment options for ketosis include intravenous injection of a 50% solution of dextrose, propylene glycol or glycerin, and ammonium lactate. Hormonal therapy may involve dexamethasone or anabolic steroids, followed by oral propylene glycol. Control measures focus on ensuring adequate caloric intake and using quality feed like silage or hay, supplemented with concentrate that is gradually increased. Providing good quality ground maize and adequate exercise is also beneficial. Clinical symptoms involve the cow remaining in a recumbent position and making little to no attempt to rise. The cow remains bright and alert, with normal appetite and bodily functions. In terminal stages, temperature may be subnormal. They may crawl, utilizing forelimbs, known as a creeper cow. Additional control includes normal milking, keeping the udder clean, and using post-milking teat dips. Veterinary supervision is required for replacement therapy with calcium, phosphorus, magnesium, and glucose. Physiotherapy through muscle massage can help restore limb muscle activity. Acidosis is a metabolic condition caused by low rumen pH due to an excessive intake of fermentable carbohydrates. This can happen when an animal's diet is changed abruptly, or when they consume too much grain. Excess fermentable carbohydrates lead to an increased concentration of volatile fatty acids and lactic acid, lowering the rumen pH. This kills beneficial protozoa and bacteria, but allows acid-producing bacteria to thrive, further lowering the pH. The lower pH causes inflammation, loss of appetite, and damage to the rumen lining. Clinical symptoms include reduced feed intake, dehydration, severe diarrhea, and lethargy. In severe cases, rapid breathing, staggering, and coma can occur. Subacute ruminal acidosis, or SARA, is a less severe but more common form of acidosis. It results from repeated episodes of low rumen pH between 5.0 and 5.5. SARA causes chronic, low-grade illness and reduced productivity. The symptoms of SARA are more subtle than acute acidosis, including reduced feed intake, increased lameness, and unexplained weight loss. It is a major economic concern in dairy farming due to reduced milk yield and efficiency. Treatment for lactic acidosis involves immediately stopping grain feeding and providing good roughage. Sodium bicarbonate is given orally. Intravenous fluids are used for dehydration and systemic acidosis. Thiamine is administered to prevent nervous signs. Prevention of acidosis focuses on feeding management, including gradual diet changes, increased fiber, and feed additives. Supplementation with ruminal buffers like sodium or potassium bicarbonate or alkalinizing agents helps neutralize pH changes. Organic acids and probiotics may also be used. Subacute ruminal acidosis, or SARA, is a metabolic disorder in ruminants, common in high-producing dairy cows. It occurs when the rumen pH drops below the normal range, typically under 5.8 for extended periods. Causes include high concentrate, low-fiber diets, rapid dietary changes, and inadequate effective fiber. Symptoms of SARA include reduced and variable feed intake, loose feces with undigested grain, decreased milk production, and laminitis. Diagnosis involves monitoring rumen pH, checking fecal consistency, analyzing the milk fat-to-protein ratio, and observing clinical signs. Treatment involves immediate dietary adjustment, such as increasing fiber and reducing starch. Buffers like sodium bicarbonate and probiotics or yeasts are also used to stabilize rumen flora. Prevention relies on adequate effective fiber, using total mixed rations for consistency, and avoiding sudden diet changes. Hypomagnesiemic tetany, or grass staggers, is a nutritional deficiency characterized by low blood magnesium levels. Magnesium is essential for nerve and muscle function. The disorder is associated with pastures of rapidly growing lush grass, often high in potassium and nitrogen, but low in magnesium. It affects cattle, sheep, and goats, often shortly after being moved to such pastures. Hypomagnesiemic tetany is most common in lactating cows grazing rapidly growing spring pasture. The risk is high after calving, due to increased demand for magnesium in milk. Magnesium deficiency impairs nerve and muscle function. Symptoms include nervousness, muscle tremors, staggered gait, and ultimately convulsions and death. Treatment requires an immediate intravenous injection of magnesium sulfate. Prevention involves supplementing magnesium, such as in mineral mixes or licks, particularly during high-risk grazing periods. Postparturient hemoglobinuria, or PPH, is a disorder primarily seen in high-producing dairy cows shortly after calving. It is characterized by severe anemia and red urine due to the breakdown of red blood cells. PPH is associated with phosphorus deficiency. Phosphorus is crucial for red blood cell metabolism and maintaining their integrity. Low phosphorus levels cause red blood cell lysis, releasing hemoglobin into the bloodstream and urine. This is often linked to diets deficient in phosphorus and high in calcium during the dry period. Symptoms include pale mucous membranes, weakness, depression, and passing dark red or coffee-colored urine. The cow may also exhibit jaundice and rapid heartbeat. Early intervention is vital. Treatment involves immediate intravenous administration of sodium acid phosphate or potassium phosphate. Nutritional intervention includes correcting the phosphorus to calcium ratio in the diet, especially before calving.